Nancy.
All right, Meg, thank you. And switching gears right now, it's National Breast Cancer Awareness Month, and it's the perfect time for women and men to learn more about the disease. Dr. Brent Wallace with People's Health joins us now with some common myths about breast cancer. Thanks so much for being here.
Thanks for having me back.
Well, breast cancer starts as most cancers do, right? It's an abnormality of cells.
Definitely, yeah. Anytime cells proliferate, they can actually form a lump. Those lumps can be cancerous, and the cancer sometimes can even spread.
All right, and we have sort of some true or false questions because there are so many myths about breast cancer. Here's one. Finding a lump in your breast means you have breast cancer. True or false?
So that one is false. Lumps need to be checked out no matter what because lumps could be cancer, but there's a lot of other conditions that can actually cause abnormalities in the breast, so you just need to make sure that those get checked out by your physician.
And having a mammogram is on the front line of trying to determine if something's wrong with you and getting early detection. A lot of ladies don't want to go because the second question, does a mammogram cause breast cancer? A lot of people think, well, it must be damaging to me.
Right. It definitely doesn't cause cancer. And mammograms are actually the most important screening tool we have to identify breast cancer. Mammograms compress the breast and can find images that could lead to a diagnosis of cancer. So they need to be done, definitely.
And for people who are afraid of it, it only takes a few minutes and it's over. So
very quick and painless.
Yes. Number 3, breast cancer only affects older women. True or false?
Definitely not. And not only women, but men need to be concerned. Breast cancer can occur in men and younger women. So anyone between the ages of 40 and 74, any women between 40 and 74 should definitely talk to their doctor about getting a mammogram done.
All right, let's look at another question. If you have a family history of breast cancer, you have a higher chance of developing the disease. True or false?
That's definitely true. There's a very large genetic component to breast cancer. So if you have any first-degree relative in your family, so a mom, a daughter, sometimes even a grandparent who's had breast cancer, you should definitely be more aware of the disease and make sure you get checked out.
And in that case, usually 40 people begin getting mammograms, but if you have a family history, you start a lot earlier than that at times, right?
Usually you start monitoring, but you don't necessarily need a mammogram any earlier than 40 unless you had a relative that had breast cancer when they were very young. But you should talk to your doctor about that for sure.
And we're looking at now, I guess, radiologists looking at pictures from a mammogram and imaging, and sometimes they can tell you either day of or within a couple of days whether you're okay or not.
Yeah, most radiology groups that you go to will review the x-ray that's done immediately, and if they identify anything of concern, they may even refer you on to get additional testing.
And again, we want to reiterate, we talked about yesterday with a doctor, breast cancer in men is a little rarer, but it happens all the time.
It does happen, and much like with women, if you identify anything in your breast area, then it's important to get that checked out.
And again, family history in that case as well.
Mm-hmm.
All right, thank you so much, doctor, for joining us.
Thank you very much.
Great.